So the tooth numbering system actually incorporates three major techniques. The first is called as the universal system. We have the Zsigmondy-Palmer system and the FDI system. The FDI system is also known as the Federation Dentaire International. So coming on to the first type of system, that is the Zsigmondy-Palmer system. This was introduced by Adolphe Zsigmondy in 1861 and later on was modified in 1874. But it was independently published by Palmer also in 1870, and that is why the system was given a combined name of Zsigmondy-Palmer in order to give importance to both the scientists who developed it individually. In the United States, it is only referred to as the Palmer system. They do not call it as the Zsigmondy-Palmer. It is also known as the symbolic system. Symbolic system meaning it uses the symbols to indicate quadrants. You remember quadrants? Quadrants are the four parts into which the oral cavity can be divided. So the maxilla has two quadrants, the upper left and the upper right, and the mandible has two quadrants, lower left and lower right. So keeping these quadrants in mind, a symbol was developed by Zsigmondy-Palmer. The only disadvantage with this particular numbering system is that this pattern is not acceptable by computer language. So in the digital era, it is very difficult for you to communicate Zsigmondy-Palmer system of tooth numbering to somebody else sitting elsewhere. So let us understand the detailing of this particular numbering system. Basically, the tooth is given a number in the permanent dentition and an alphabet in the deciduous dentition. But you see the quadrant, so we are dividing, you have to imagine this as the oral cavity, and the oral cavity is dividing into four quadrants. So keeping the shape of the quadrant, that is used as a symbol for mentioning tooth in that particular quadrant. So if I want to talk about the maxillary right quadrant, I will use the symbol like this. If I want to talk about the maxillary left quadrant, I will use that quadrant symbol and then write the tooth number accordingly. For the permanent dentition, we use numbering from 1 to 8. The numbering always begins from the midline and then proceeds away from the midline. It is the same for the maxillary as well as the mandibular dentition. For the deciduous dentition, we use alphabets A to E. Remember, 5 teeth the deciduous dentition has in each quadrant. So that is why A to E in each quadrant. So you see the symbol? This symbol, when I write the symbol and I write the tooth number, the other person will understand which quadrant I am talking about and which tooth I am talking about. So if I write the one with this symbol, then I am talking about the maxillary right central incisor. If I write the one with that symbol, then I am talking about the maxillary left central incisor. So that is why this is called as a symbolic system, because all the teeth in all the quadrants carry the same number. The number does not change, but the symbol changes. So that is why this is called as the symbolic system. So let us see how does this work. So the jaw is divided into 4 quadrants. The numbering always will begin from the midline and proceed away from the midline in all the 4 directions. The shape of the quadrant is used as the symbol, and the tooth to be mentioned will be written in that symbol only. So if I want to talk about maxillary left, I will use this symbol and write the tooth accordingly. If I want to talk about maxillary right, then I will use this symbol and talk accordingly. If I want to talk about the mandibular right, I will use this symbol and write the tooth number. And if I want to talk about the maxillary left or the mandibular left, then I will use this symbol and write the number. For the deciduous dentition, I will use the same symbol but write the alphabet. That is how I write the Zsigmondy-Palmer system of tooth numbering. The problem with this, like I told you, was computer language did not accept the symbolic pattern. You cannot draw this symbol in computer language, and that is why a new system was introduced, which was called as the universal system. So the universal system did not incorporate the symbols, and that is why it did not divide the jaw into quadrants at all. It gave a different number to each tooth. So, each tooth was given a separate number starting from the upper right quadrant, going on to the upper left, following down to the lower left and ending in the lower right. This way what happened? Each tooth had a unique number. Just like you have your Aadhaar number, which is a unique identification number, similarly each tooth in this particular system had a unique number, and that is why the need for the symbol was eliminated. They have used numbers for the permanent dentition and alphabets for the deciduous dentition, but the pattern of numbering is the same. For the deciduous dentition, the numbers A to T have been used starting from the upper right quadrant and ending in the lower right quadrant.